Hi everybody, I'm gonna tilt my camera a little bit higher. I'm so sorry about the quality of the camera. Um, I went blank. My name is Keisha Williams and I will be doing the incentives pyramid video. This is my daughter, Serena Williams, so she's gonna be assisting me with the video today. So I'm gonna use her as my patient. So I come into her, knock on the door, I come into her room. I introduce myself, Nurse Casey. My name is Nurse Casey, and I'll just tell her what the reason why I'm here is to provide her with education about the incentives parameter and why is necessary for her to use it. I will go ahead and also perform my hand hygiene. Then I'll have her identify who she is and any drug allergies that she may have. Please tell me your full name and your date of birth.
My name is Serena Cashel Williams. My date of birth is December 21st, 2011.
Thank you. Then I'm gonna go ahead and check her wristband just to make sure that she is what she says she is and that her birthday is that. I'll also ask her about drug allergies and if she does have drug allergies, it would be on her wrist as well, a wristband on her wrist. So once she has identified herself, we're gonna go ahead and start the education. Seeing that I've already explained to her why I'm here and the purpose of why she's using, I'll just go ahead and explain the purpose to her as we do this. So this is the incentive spirometer. It comes in the package, so you'll open up that package. I will not demonstrate it for her just because I'm not going to allow the patient to put their mouth on something that I put my mouth on. So I'll take it out of the package and then I will give it to her to show her how to do it. And then it also comes with this paper with the numbers, and then there is, let me put this down, then there's also this portion right here that you could fill out. It tells you the goal, and the doctor too will tell us where, because right here is that, oh gosh, I suddenly don't remember the name, you can't see what I'm talking about, the goal. So we will indicate, and this is also based off the age and stuff, and this also tells you the volume. So right here it will tell you the volume attained. So it starts at that 250 and it goes all the way to 2500, and then we have to have like a goal for the day. So see, Serena's goal is 250, so she's just gonna be practicing that. Excuse me. So we're gonna have her do it, oh my gosh, sorry, while she's at the hospital after surgery. We're gonna have her do this like every hour. So she's gonna want to do it at least 10 times in the hour. After surgery, everything is still asleep, so we want to get things up and moving. So using the spirometer will help to assist with breathing and will assist her with the recovery. So not just the surgery, but with the anesthesia. I struggle saying that word. It does create less activity in the lungs, and then there's always that risk of pneumonia after a person has surgery. So we're just trying to prevent the complications of surgery while trying to wake everything up for the whole process of recovery. So we encourage the use of the spirometer just to help with that lung and moving the air in and out and just waking up those lungs. So I'll just go ahead and teach you how to use the spirometer. I'm gonna tilt it down a little bit so that you guys can see. And we're gonna go ahead and, are you comfortable?
Am I supposed to rest my back?
You can. I just want you to be comfortable. But I do need you to sit up so that you can use this. So just comfortable, like in a sitting position. So this will help you to promote lung activity. Like it measures your lung capacity as well. So we're looking at the volume of air in the lungs when we inhale. So at least about 6 liters of air. So what you're gonna do is you're gonna put your mouth on this piece right here, and then you're gonna pay attention to this and this. Oh, one more thing, it also tells you right here, it says best, better, good, so she could see where she is at when she inhales into this. So I'm gonna bring this down, so we're gonna do like 250, and then she's gonna look at this so she could tell if she's good, if she's better, if she's best. And then all she's gonna do is inhale into the spirometer. So this is the mouthpiece. She's gonna put her mouth over the mouthpiece. Just cover your mouth with it. I hope you guys can see that. So she's just gonna turn your head slightly so they can see. So she's just gonna put her mouth over the mouthpiece, and you're not breathing out into it. You're actually breathing in. So breathe in See that? Let's lift it. So let's tilt it so much, a little bit more so that they can see. Yep. So now breathe in for me. See that when she breathes in, it moves. So we don't want them to breathe in fast. It's just a slow, controlled movement to help with that. So you're just going to take a nice, slow, deep breath in and hold it for like 2 to 3 seconds. And then when she holds it for 2 to 3 seconds, then she's going to release the air. And then she's going to do that 10 times in the hour to help promote her air. So you could just continue doing that while I talk. You just breathe in and you hold it for 2 to 3 seconds, and then you exhale. And then you do it again. And we're going to do it 10 times.
Okay.
So, like I said, yeah, she's going to do it at least 10 times in the hour, every hour, while she's there until she's able to get up and ambulate again. But we want to encourage that, help prevent the pneumonia. The readings, the goal is going to be based on what the doctor wants. But then just remember the FV1, we're at least looking at between 80 to 100%. Because usually if you're less than, let's say, if you're less than 50% on this, then it kind of tells us that your lungs are not working fully, that maybe your lungs are partially working. So we want to maintain a number of 80 or between 180 to 100%, 120, all the way to 120%. But we just don't want anything less, because then it tells us that the lungs is not working like they should, or that it's not handling much air as they should. So we're wanting the volume of the air in the lungs when we inhale, and we want to make sure that it is at least 80%, not lower than the 80%. Now, for patients who have, what is it called? Lung diseases like COPD. Let me tilt the camera just a tiny bit because they're not seeing you yet. So for like patients who have COPD, they're still going to use the incentive spirometer because everything is still asleep, and you just want to wake those lungs up. You want to wake everything up after surgery, hence is why they always encourage ambulation, once they get back to the post-op. Not PACU, but like not med surgery. What's it called? After surgery and you go to PACU and everything is fine, they take you to that other room. Oh gosh, what's it called? I mean, I work at the hospital. I should know this. Oh my gosh, it's not coming to me. But then they take you to that room, and then you kind of want to get the patient ambulating as soon as possible to help wake up those organs and to just help wake up everything, to help prevent the blood clots. So a COPD patient or a patient with a lung disease is no different. You still want to get them to open up those airways, open up that lung so that they can breathe. And we're just measuring that lung capacity, as I said. So, we do want to keep those values above 80%. I'm trying to think of anything else that I need to tell you guys. This is always highly encouraged after surgery. And we'll just go ahead and get started. So like I said, we're going to do this 10 times in the hour. So she's just going to breathe in, hold that in for 2 to 3 seconds, and then she's going to let it out. And we're going to do it 10 times. Okay? Good. Okay. So when you breathe in, you want to breathe. Just take a deep breath in. That's all you're doing. You're taking a deep breath in, and then you're letting it out after 3 seconds. I'll tell you when to let it out. And you slowly let it out. Deep breath in. You got to make sure that your mouth stays on the mouthpiece and you're holding in that air. Okay, do it again. Deep breath in. Breathe out slowly. Okay, do it again. Good job. Still down a little bit. Okay, do it again. Now, as you can see, when she breathes in, that little, I can't think of the name, but it goes up when she inhales. And then you'll also just see this bottom part right here. I'm just going to lift it up a little bit. Move. So could you do it again for me? Take a deep breath in. So this will tell us right here how millimeters of the inhaled volume. So say if the patient has a goal of 2,500 a day. Let's see you do it again. And they're only reaching maybe 250. Then we know they need to just keep working on that every single day. Like I said, every hour, at least 10 times in the hour. So she would have to really, for her age, and it's also based on age too, and that lung capacity and how much that lung could do, we're gonna leave it at least to 500. We're gonna try to have an aim for 500. Let's see if we could do it again. Let's see. Okay, so she's passing that 500 mark and she's getting to 1,000. So that tells me that her lungs are working, and that's good. But if they're like, say the doctor said, oh, we need you to get to 2,000, and they're barely even getting to 200, then we know, okay, that lung is not, performing in the manner that it should be performing. So we're gonna keep doing this and make sure that we're on top of it so that they are getting it. So that is the whole purpose of the incentive spirometer, is to just help them with that lung capacity and getting that volume of air in. And if you're really not sure what values or numbers to be looking at, like I said, it does come with this nifty piece of paper here that kind of tells you the ranges, and it also comes in Spanish too, so it kind of tells you those ranges of where you want that volume to be. And the doctor will also tell you where he wants that volume to be. But the whole thing is just to get your lungs up and moving and help with breathing and recovery, which is very essential, especially to help prevent pneumonia, especially in the older population as well. We really want to prevent that pneumonia. So that's all I have for you concerning the incentive spirometer. I'm just trying to think if I left anything out. I don't think I have. But yeah, and one thing you could do too is that every time, either a CNA or you, the nurse, enter that room, you could remind the patient, hey, have you done your inspirometer? Like, if not, let's go ahead and get that started again, because sometimes they forget and sometimes they just don't want to do it. So it's good to tell the CNAs that when they go in the room, just to give the patient a quick nudge or reminder, hey, have you used your incentive spirometer? We gotta get that, those lungs open up and those lungs working, especially to help prevent pneumonia. And just kind of always remind them to just, hey, we don't want this to happen, so this is why we're having you do this. And that should work. So yeah, just have people anytime. So you guys go in the room, just remind them to use that 10 times in that hour. It doesn't take long. It's just 10 times. You're just breathing 10 times every hour. Just that's all it is. You're sitting down, you're laying down, watching your TV. You're just pick it up and 10 times. But that's all we have for you concerning the spirometer. Thank you for watching.
Just remember to do it after surgery.
Yep.